Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Julia. Julia, please introduce yourself.
Yeah, absolutely. Hi, everybody. My name is Julia Schmidt, and I am the Administrative Fellow with the Advocate Health Midwest Medical Group. And I am originally from Wisconsin and did my undergraduate degree in neurobiology at the University of Wisconsin Madison, and had a couple of changes in career paths that led me to the world of healthcare administration. And so, straight from undergrad, I went and got my master's in health services administration at Xavier University and am now here at Advocate Health as an administrative fellow. And super excited to talk to Cole today.
So, yeah, you have a great career path. You've done a few different things that all have kind of are culminating in this fellowship right now.
Mhm.
So, originally you got your bachelor's in neurobiology, which is a really difficult degree to get. Can you tell us why you? Because I was originally working in neurology, and so some of them
Oh,
were
okay.
had studied this, and it was terrifying how intense this was. So, why did you choose to pursue this degree, and what benefits have you seen from it, even though you changed fields?
Yeah, that's a great question. So I have always really been very interested in science, like ever since I was a little kid. And so I always knew that I wanted to study something around biology. And I had originally planned on going some sort of clinical route. I looked into genetic counseling and was really interested in that for a while, but ultimately kind of realized that that wasn't the right path for me. So I kind of bounced around public health and then ended up landing in healthcare administration. So I think that there's honestly been a lot of benefits from having that kind of a degree. I mean, there were a couple of other people in my program that came from the science world, but I can tell you, like, when it comes to talking with doctors and understanding all of like the medical terminology, having conversations with them and having kind of a just a basic knowledge of medicine, it's so much more helpful to have those kinds of conversations and really be able to connect the dots and know when you're trying to solve an issue like what diabetes patients need and what like a certain heart surgery looks like. And my other experiences, like I worked in a couple of different research labs as well, so I've kind of gathered a lot of science knowledge that I definitely can apply a little bit to my time as a fellow and in the healthcare administration world, which is really cool.
Excellent. It's great to see that even though there's a change and it's a bit different, you're still able to apply that knowledge. I think that's
Yeah, yeah,
wonderful.
absolutely.
Why did you choose to go to Xavier?
Yeah, so like I said, I'm a Wisconsin girl, so Midwest at heart. And so I really wanted to stay in the Midwest. We have a lot of really great programs in the Midwest. And particularly, I was looking at Xavier and Minnesota.
Mm,
And it really came down to how I meshed with the the professors and just like the overall structure of the program. And it also helped that I got a pretty good scholarship from Xavier as well. So that helped in the decision. But one of the big things that drew me to Xavier was the alumni network. They have a really, really vast alumni network, and I have already seen it benefit me in multiple ways. So that was a huge deal for me in choosing to go to Xavier.
that is excellent. I think it was a good choice. Xavier has some really good connections, and I know quite a few people who've gone there and they've really enjoyed it. So, and
Mhm.
the Midwest is such an interesting place. We've been trying to meet more people from there because I'm from the Northeast, and it seems like a wonderful place to live. People are very kind, so I understand why you'd want to stay there. So after you got your, well, actually during, right, during your MHA, you were the chief medical officer's intern. Can you explain what that is, what that's like? That's kind of a unique role. I haven't really heard of anything like that before.
Yeah, absolutely. I had not either, which sparked my interest for sure in kind of pursuing that role. So what that really entailed was at the University of Cincinnati Medical Center and their UC Health brand, they have a, a structure where the chief medical officer has a couple of different departments under him. And so his chief of staff was actually my boss. And I worked really closely with the project management team that worked with the service lines and then also the performance improvement team. And so a lot of my work revolved around their service lines and really rolling out a lot of the performance work and improvements and things like that. So it was really cool because I got to see a lot of different service lines just spread across all of the different facilities and really build some skills in project management and performance improvement, and also got some exposure to a lot of other services as well. So it was really cool.
Absolutely. That sounds very interesting. And then
Mhm.
was it challenging to get that internship? How many internships did you apply to? What did that look like?
Yeah, I think, let me think, that was a long time ago. I think I applied to probably about 3 or 4 internships. The Cincinnati area honestly has a very like robust healthcare community, and so I just planned on applying to the local organizations. And UC Health and Xavier have kind of had this partnership over the years, and so that was one that was presented to our class. And I think it was me and probably 12 of my classmates that applied for it. So I felt really grateful to get the opportunity. But yeah, I think it was just a couple, and it was just your typical kind of application and interview process.
Nice, nice. That's really good, and also good advice for everyone else out there that you didn't have to do anything too crazy to
Mhm.
to get the role.
Yeah,
So you decided to apply for a fellowship. I actually isn't that part of Xavier's program?
it is. Yeah. So for me, I knew like before I went to my grad program that I was going to want to do a residency or fellowship just because I was coming straight from undergrad. And so personally, I really wanted to have that extra year or two to learn and grow and build my skills before I really was put into a leadership role kind of full time. And so it is a part of Xavier's program. I think they're like one of 7 in the country that requires that third year. So like like yes, I technically was required to do it, but I still did really want to do a residency or a fellowship.
And why did you early on know that that was something that you really wanted to do?
Yeah, I mean, I think that from what I had heard from other people's experiences, it it opens up a lot of doors. You have an opportunity to make connections with people and throughout the organization and the industry that you don't necessarily have the opportunity to do just because of the exposure that you get. And also, I am someone who I really like the opportunity to kind of have a cushion as I'm learning and feel comfortable enough to push myself a little bit outside of my comfort zone with not necessarily having to be in an environment where it's going to make like a huge impact if I screw up. And so that's another thing that I've really enjoyed throughout the fellowship is kind of having that flexibility in learning from some mistakes. But yeah, I there's a ton of benefits from going for a fellowship. So a lot of reasons why I knew I wanted
Nice.
to do that.
Of course, we've heard a lot of people really, and even people who are, have years of experience. They've even gained a lot from the fellowship. So
Mhm.
it seems like it's a really well-rounded experience. How many fellowships did you apply to, and then why did you apply to and then choose Advocate Health?
Yeah. So my personal situation played a lot of a factor in which places I applied to and how many. So just for some context, I got married in August. So I was,
Congratulations.
thank you. I knew I was going to be getting married back in Wisconsin. And so for me and my husband, we're both from Wisconsin. And that was really kind of our big goal. And also just aligning with where his career was going as well. So I really just focused on Wisconsin, and I applied to, I think, the four organizations that had or that were offering fellowships this year. And I mean, all of them are some really wonderful organizations, but Advocate Health specifically stuck out to me with its commitment to the community and health equity. That was a huge, huge thing for me. In my first interview, I remember just beaming. I could not stop smiling because they were kind of going over some of the initiatives that the organization is was hoping to do. They have done some of them now, but it was just something that really resonated with me, and that was everything that I was looking for, is to find a place that my values align and I'm excited to contribute to the work that they're doing. And so that was a huge deal for me in choosing Advocate as my fellowship location.
And so it's so nice when I hear that. I think Audrey said something similar. When the values, mesh there, it's so
Mhm.
important. And I found that the fellows who do find that where they really feel at home, they do tend to do better than some of the fellows who don't. So I think that's excellent.
Mhm.
What? How long is it? By the way, what did you say it was a year?
It's a year
You
here.
did okay,
Hmm.
and so you're almost done with it. Then you're on the
Yep, I'm
final.
on the job hunt.
How do you feel about that? Are you going to try to work for Advocate, or are you looking at other areas?
Yes, 100%. I have absolutely loved it. And honestly, was just having a conversation with one of our leaders the other day, and he said, Advocate is one of those kinds of companies that you kind of work for the rest of your life. And I said, I kind of felt that on the first day, that this is probably going to be somewhere that I'm going to be staying for a very long time. So I have a ton of support from my preceptor and all the other leaders in the organization to help me find a role that's really going to fit me and the organization. And I'm, yeah, really looking forward to continue working with Advocate.
Wonderful. And so just to kind of refresh my memory a bit as well, is it
Mhm.
a rotational project based? What is that looking like?
Yeah, so
I guess
it's project.
few months.
Yeah, it's project based. However, we do in the Midwest do a couple of rotations at the beginning of the fellowship. So I'm not exactly sure if the structure will be the same going forward, but this year we were able to do a 1 month rotation with HR, finance, and business development. And they that was like our first 3 months of really just giving us some exposure, building our knowledge and skills in those areas. And honestly, that has been hugely helpful for our project work that followed those rotations, and really making those connections ahead of time and knowing who we needed to go to for all of those areas to help us to support our projects.
Absolutely. And what are some, or one, I guess, what's one of your favorite projects that you've worked on?
Yeah, so my primary project is honestly super cool. So I'm the fellow with the medical group. And so my primary project right now is focused on supply chain optimization for all of our 500 plus sites, which is just an insane opportunity. And so I'm really focused on the supply management part of our supply chain. So, really, like the end users in our clinics and kind of optimizing and making that more efficient.
That sounds very exciting and also very
Mhm.
vast. So I guess
Yeah,
you feel pretty prepared to take on what your next role is.
I do. I do. And I won't lie, I have asked my preceptor, are there any like gaps that I am missing before I move into this next role? And I think that's honestly the beauty of the fellowship is like these next 2, 3 months that I'm in it. If there were any gaps, I could go and learn anything that I needed to fill those. But my preceptor said that he feels very confident. I feel very confident in the experiences and projects that I've had so far have definitely prepared me for my next role.
So, you have really been successful in your projects. You have received excellent feedback from your preceptor. What recommendations do you have, if you had to be introspective and ask, why have I been successful? What would you tell, us about why you've been successful, and recommendations that you'd have, for somebody like myself who's just starting off at the beginning of my grad school career?
That's a great question. I think that when grad school and being an administrative fellow are so different. And so I think that a huge trait that has really helped me in my success just through this whole process has honestly been to be adaptable, to be able to also go outside of your comfort zone. A lot of this is not easy stuff, and you're interacting with a lot of people who are intimidating and super smart. And so I think that those two things have definitely helped me to just kind of push myself and meet new people and get out there. And kind of along those same lines is to really just take advantage of networking and making connections. I have been so successful in my project work and really just finding different experiences throughout my fellowship through making all of those connections. And I definitely was not someone who understood the power of networking until I was exposed to it. And now I really understand it and am very grateful for the network that I've built and will definitely continue building. For example, ACHE is next week, so absolutely encourage people to go to events and conferences like that. And there's some amazing learning opportunities and networking opportunities.
Excellent advice, and similar story with myself as well. I still don't believe the power of networking, even though my current role is only due to networking. Really, I still don't believe it. It's just odd in a way, but it does make sense when you think about it, that
Mhm.
can't showcase a lot of these skills unless you're networking with people. And excellent advice you've given. Thank you for joining us. I know, are you in Central Time? I think in Wisconsin.
I am, yep.
Okay, so it's a little bit earlier in the evening for you, but still, the evening. Thank you for joining us and taking
Yeah.
this time. I really do appreciate it.
No, absolutely. Thank you so much for having me. It was really awesome to talk to you and would look forward to having more conversations in the future.